Murder technology. The room in which execution is carried out through a deadly injection is often more like an office in an expensive private clinic. Its main attribute, a special sunbed, on which execution is carried out. It is equipped with belts to fix the executed. It is also equipped with special armrests on which hands are fixed with belts. Sometimes, if provided by the design, the sunbed can rise from the horizontal position to the vertical. In some prisons, ordinary medical skating is used at all. Before the lounger or side, in the wall, a large window is equipped, through which, invited people, they can monitor the execution of the guest's room. The window necessarily has curtains. Behind the sunbed, there is a staff room. It is from there that the execution is carried out. By the way, in China, mobile specially equipped vans are quite effectively used, in which criminals are executed through a deadly injection. In more detail about the process of execution. After the last meal, executed, they are brought into the room. As a rule, from clothes on it only underwear and a free shirt to the knees, and necessarily, with a short sleeve. He falls on the sunbed, and the prison staff fixes him with belts. Then, a medical worker, often hired, needles with long tubes that go to the staff room are introduced into the veins of both hands. The death penalty is carried out through one line, the other line is reserve. For verification by pipes, physical and medical. Meanwhile, the prison staff fixes the executed sensor on the chest to control the heartbeat from the staff room. At the same time, syringes with drugs are prepared. In total, there are 6 syringes, 3 for each line. A sticker with the name of its contents is glued to each syringe in order to avoid confusion, and in order not to violate the correct sequence of the drugs administered. All of these operations are carried out with maximum sterility, for 2 reasons. The first, so that the prison staff does not receive an infection with an accidental injection with a needle. And the second reason, the execution can be cancelled or postponed for a while at the last moment, when the needles have already been introduced into the executed veins. As it was in the case of James' drop-off in October 1983. After completing the preparation for the execution, the curtains on the window of the guests are opened, and the sunbed is transferred to a vertical position, and executed. The last word is given, after which the sunbed is lowered. The execution process begins. In the classic version, where the so-called Texas cocktail is used from drugs. First of all, in the block, to which the tubes are connected, syringes with an anesthetic are inserted. On the command of the leading execution, a person executing execution introduces a drug into Vienna, pressing a syringe to the piston. In some states a mortal injection machine is used, to which 2 remote controls are connected. 2 people are executed simultaneously pressing buttons, and a computer connected to the machine in a random order launches the car from one of the remote controls, after which immediately deletes the information from which the remote control was the launch. This gives some relief of conscience, because none of the 2 executing executions knows who exactly launched. The cost of such a car is not small. when an anesthetic will lose consciousness for 30 seconds in the Vienna executed, after which the pipe is washed with a physical A solution and only then the next drug is administered, namely, a long-acting muscle relaxant of a long-acting that leads to paralysis of skeletal transverse striped muscles, thereby stopping breathing. The pipe of the line is washed with physical solution, preparing for the introduction of the third drug. The consistent administration of drugs with intermediate flushing of the physical system with a solution is necessary so that the drugs do not mix, which can lead to precipitate and blockage of the needle or vein. While the line is washing, the prison staff inserts the last 2 syringes into the nests of the system. Namely, the chloride is potassium that causes a cardiac arrest. On average, death occurs within 5 to 7 minutes, of which only the first 30 seconds executed is conscious. Is it possible to name this method of execution humane? No. For several reasons. One of the first, from the beginning of the introduction of a deadly injection to the present day, all the states in which it is practiced has experienced difficulties in buying the necessary drugs. Pharmaceutical companies introduce constant prohibitions on the sale of their drugs for the death penalty. The second reason is the consequence of the first. Due to the deficiency of drugs, their doses often reduce, which of course, does not benefit fast and painless death. In many states, if possible, make reserves of drugs for deadly injection. And recently, in search of alternatives to prohibited drugs, one drug is often used as a rule. One large dose of barbiturates is the third reason: negligence, or a low level of professionalism of personnel leading execution. Indeed, even in the case of using a machine for deadly injection, the needles into the veins are still introduced by a person, not a car. As an example, the needle in Vienna directed towards the fingers can already be the cause of the protracted death penalty. Brief story. On January 17, 1888, a doctor from New York, Julius Mount Blair, proposed executing prisoners using a deadly injection. Blair claimed that this type of execution would be more humane and cheap than hanging. But the proposal of the doctor did not receive approval. The first use of a lethal injection was in the Nazi Germany to execute prisoners under the euthanasia of T4. The Death Penalty Commission of Britain also considered a deadly injection as an alternative to hanging, but under the pressure of a medical association refused this type of execution. On May 11, 1977, the forensic expert Oklahoma J. Chapman proposed a deadly injection as an alternative to an electric chair, assuring that this type of execution is more humane and painless. Thanks to the support of the priest Bill Weisman, the deadly injection was introduced into the legislative body of Oklahoma, where this type of execution was quickly approved. As of the 2020 year, deadly injection is the most common type of death in the world. Deadly injection in phases and terrible cases of execution. Texas on December 7, 1982, the first execution with the help of a deadly injection in the United States. Charles Brooks Jr. was executed. And the first execution, surprisingly, passed quite quickly and painlessly. Brooks died within 3 minutes. After the introduction of the first drug, Charles Brooks yawned and lost consciousness. North Carolina. On November 2, 1984, with the help of a fatal injection, the first woman was executed. Velma Barfield. December 13, 2006, Angel Neva Diaz died only after 35 minutes. The autopsy showed that his vein was pierced by the needle through and through the drugs entered the muscles. On September 15, 2009, the greatest execution of Rommela Bruma was stopped after 2 hours. The copper personnel tried to no avail for the Brum's body suitable for injection of the vein. January 17, 2014. Dennis McGarr was suffocating before his death within 12 minutes. The cause of his painful death was new, unverified drugs, which after his death were banned for execution. Clayton Lockett died of a heart attack after an unsuccessful execution on April 29, 2014. The execution of Christopher Newton was completed only after 2 hours and on the 10th attempt on May 24, 2007. The cause of such a protracted execution was the excess weight of the criminal, because of which the suitable veins on Newton's body could not find for a long time. Doyle Leham in February 2018 was never executed, despite the fact that doctors within 2.5 hours in search of suitable veins literally soured the entire criminal, trying to introduce the needles even into the inguinal veins. Doyle Leham has been waiting for execution since 1987. After a series of unsuccessful executions through a deadly injection, in 2015, a survey was conducted in the United States in which more than half of the respondents opposed the death penalty, which has been a record since 1972, when a moratorium was introduced in the United States for 4 years. Who knows, perhaps the story will be repeated, but this time the death penalty will be prohibited around the world, until the moment when a new, even more humane way to perform justice will appear.